Wales has become the first UK country to say it will offer COVID-19 vaccines to all children aged between 5 and 11 years old. So far, only vulnerable children had been offered a vaccine in a strategy that's seen the nation lag behind its US and European neighbours. Health Minister Eluned Morgan announced the new Welsh recommendations in a speech to the country's legislative body on Tuesday. But she went on to say in a written statement that Wales' vaccine strategy won't be updated until national guidance from the UK's Joint Committee on Vaccination and Immunisation, JCVI, is published. Vaccinating young children has been hotly debated in the UK, with new guidance from the expert body reportedly delayed over government disagreement. In the meantime, Morgan said, all families with children between the ages of 5 and 11, who are not in any clinical at-risk groups, should begin talking about whether they wanted to take up the new offer. In spite of being the first country to approve a COVID-19 vaccine for adults, the UK has been slow to vaccinate children. The U.S. Centers for Disease Control, for example, recommended COVID-19 vaccines for kids aged 5 to 11 back in November. And the European Union has been jabbing the age group since December. Morgan told Welsh policymakers this has likely been a difficult decision for the JCVI, because children tend to experience milder COVID-19 symptoms. Vaccination itself carries a real, but very low, risk of serious complication. This has to be factored into decision-making, as does the level of disease circulating in the community. Of course, the JCVI also has to balance that against the prospect of missing school, Morgan told Welsh lawmakers Tuesday. In December, the body said it was seeking guidance from the Department of Health and Social Care and other government bodies on the potential impacts, positive and negative, of kids getting vaccinated on education. Morgan said children's vaccines would not need to be rolled out as quickly as the country's recent adult boosters were.